I listen to patient stories. I make diagnoses, and I help patients get better. Over the years, I've listened to thousands of stories. But today is not an ordinary day. Today, I'm going to tell you a story that may save your life or the life of someone you love. Rewind. It's 1974. I'm 12 years old, and I'm getting ready to start a new middle school. Like most 12-year-olds, I'm anxious and awkward and self-conscious. However, I'm really looking forward to making new friends. That first day, I even had a brand new hairdo. I had wings, just like Farrah Fawcett from Charlie's Angels. I went to school, I attended all of my morning classes, and not one kid spoke to me. So at lunchtime, I was sitting in the cafeteria at a table by myself, eating my turkey sandwich, feeling completely invisible. And then a girl walked up, and she said, "Hi, my name is Tammy. Can I sit here?" And I said, "Sure." Tammy and I had similarities. I was the only black girl in our class, and she was the only Chinese girl in our class. We were the only minorities in our class. So we were relative outsiders at our school, but we knew that one day we were destined to live in a bigger world. There were similarities at home, too. We were both raised as only children, and we were so lucky to have the full and undivided attention of our overprotective parents. Together, we formed a sisterhood, the sisters that we wished we had at home. We had school, we had sports, we had shopping, we had sleepovers, we had a lot of fun. And like sisters, sometimes we had disagreements. Usually they were discreet and easily resolved. I like vanilla, you like strawberry. Cool. We were mindful and demure even back in the day. By the time we were in 11th grade, we had a bit of a rough patch. We had a bigger friend group. And one day at school, we had an argument. I can't even tell you what the argument was about. I truly don't remember. However, we got heated, and after school, we went to the parking lot and drove off with drama, fast and furious. I had a Camaro with a V8 engine. Needless to say, I was distracted, and I caused a fender bender. The other driver was okay. I was okay. My car was going to have to go to the shop, and I was going to have to tell my daddy when I got home, because there were no cell phones in those days. But the person I really wanted to talk to was Tammy, 6677804. Her number is still etched in my brain. When she answered, she was crying. And I said, "What's wrong, Tammy?" And she said, "I wrecked my car on the way home from school." And I said, "I wrecked my car on the way home from school." And together we sobbed and we snorted and we were emotional wrecks. And we promised never, ever to be mad at each other ever again. We had that 50-50 friendship flow. I would do anything for her, and she would do anything for me. We went from going on first dates to both ending up marrying men named Ken. We went from reading the classics in Latin to teaching our own children to read. We went from learning to drive better to both driving minivans. And we went from trying to convince our parents to let us do anything to having to say goodbye to our parents. And although we lived on opposite coasts, we were still very close in all the ways that mattered. Then on February 15th of this year, I received a call out of the blue that I never expected to get. Tammy's kin called me to tell me that Tammy had suffered a heart attack and died at their home. I said, Tammy? Tammy was super fit. Tammy taught yoga. Tammy taught swimming. Tammy taught yoga on the paddle boards in the swimming pool. Tammy had a lovely home life. She was the literal picture of health. Why, my sister? My dear sisters, I started to look at the stats for heart disease in women. Did you know that 60 million women in the United States are living with heart disease right now? 60 million. That's like twice the entire population of the state of Texas. You absolutely have a female friend with heart disease, and she may or may not know it. I also learned that according to the United States Center for Disease Control, from their 2021 data, that regarding deaths in women, 1 in 5 is due to heart disease. 1 in 5 women. That's like losing a member of your basketball team. It's like, wow, who else didn't know that? Those stats are significant. So heart disease, what are the risk factors? Well, I think everybody knows that smoking is bad for you, and smoking is a risk factor for heart disease. But also, high blood pressure is a risk factor for heart disease, and hypertension, similar names, diabetes, high cholesterol, those are all risk factors too. Your family history is in the mix. But exercise is supposed to keep your heart strong. And Tammy exercised all the time. Did she have these other risk factors? Well, we talked about a lot of different things, but we never talked about the specifics of our health. Did she have symptoms? And if so, did she tell anybody? Did she tell her doctor? I think there's more to the story. On Broadway, there's a very popular musical called Hamilton. And within that show, there is a song with a refrain that goes like this. Who lives? Who dies? Who tells your story? Who tells the story of your life, your loves, your legacy? We women have such big hearts that sometimes we neglect our own health while we are so busy doing everything for everybody else. When we do go to the doctor, we expect the doctor to see us for who we are, to listen to us, to respect our choices, and to help us get better. We trust the doctor to tell us the truth, the whole truth, and nothing but the truth. Now, I want to offer you a broader perspective. Did you know that doctors use medical algorithms to diagnose and treat patients? Yes, algorithms, like the social media algorithms. Patients are a constellation of variables that create an identity. A variable in a medical algorithm may be something like your age, or your weight, or your sex, or your past medical history, or your race. And what that means, if you have a patient who is classified in the Black race, that patient has a different calculated risk score than a patient who is classified in the white race or in the Asian race. And that difference in the calculated risk score may make a difference between treatment or no treatment. Now, I want to be clear. Race is a social construct. Race is not biology. I bet you already know that there's gender bias in medicine, too. So, say a man presents to the emergency department. He says, "I think I'm having a heart attack. My chest hurts. It feels like an elephant is sitting on my chest." Well, then the emergency room staff would start the diagnostic workup to rule in or rule out a heart attack in this man. On the contrary, say a woman presents to the emergency department and she says, "I think I'm having a heart attack. My chest hurts. All of a sudden, I got really tired and I'm sweating." Well, maybe the emergency department staff would start the workup for a potential heart attack, or maybe not. Maybe they wouldn't rule in or rule out a heart attack in this woman. Maybe they would present an alternative diagnosis, like, "You're having a panic attack," or "You're suffering symptoms of menopause," and the woman is discharged home. Also remember that women are underrepresented in the longitudinal medical studies that design the treatments for heart disease. So there is a general lack of awareness amongst both healthcare professionals and women regarding heart disease. So I share this information and insight with you to help inspire you to think, what do I want to do now? How do I want to live now? I share Tammy's story because she was a very important person. She taught me the power of connection and the power of being a person for others. She had a gift for listening, so all voices were heard, and she had a gift for seeing, especially those who felt unseen, like me. She had a wonderful life, and her memory is a blessing. However, it is also a stark reminder that heart disease does not discriminate, although the medical algorithms may discriminate. It doesn't matter how fit and fine and healthy and hearty you look on the outside, because as we all know, it's what's on the inside that really counts. So when it comes to your health, the stakes are high. Be your own advocate so you don't die. Race and gender bias exists, yes, but ask your doctors questions. Make the information flow. We have to share knowledge to prevent heartbreak. Losing one friend is all it takes. Get up and get on it. Eat right, watch your sugar, watch your salt, know your family history, make sure you don't smoke. The most important thing is to surround yourself with a beautiful community of people you love and people who love you too. The heart of friendship is one heart, many souls, and many, many, many stories. Who lives? Who dies? Who tells your story? Thank you.